Okay, so we are live and there is a little bit of a delay, so we're going to wait for everybody to kind of start coming in. I know you can't see me yet, but there's a reason. So I have this set up right now on our wall of fame, and this is a wall that we have in the office that I absolutely love, and it's super inspirational and exciting. So we started this maybe 2 years ago. I'll kind of come in the shot and chat with you guys for a minute while everybody's kind of coming in. So this is the Wall of Fame that we started a couple of years ago. So what we do is students that come in and they get tutoring, they can either come in physically to our office, or people that join us online, or they come in for individual sessions, and we watch them kind of journey through nursing school, and we kind of watch what that looks like. And it's a really beautiful thing to walk them through nursing school and to see them learn and get excited about things. And so once they graduate, we try to go to as many graduations as we can because we're super excited for everybody that graduated. They can either bring in a picture or send in a picture or email it to us, and we put their picture up on the Wall of Fame. So everybody that you see here has been students at Ivy League tutoring before. We've journeyed nursing school with them. They've learned all the things here, and now they are out in the world being beautiful and amazing nurses and healing everyone. So it's super exciting when students come in here, if they actually come into our facility here, which I know a lot of you can't because you're somewhere else, but if you ever come and visit Houston, which surely you will for some vacation, come by our center and you can tour it and see how exciting it is. And people get really, really excited about having their picture up there. Some people get really excited, and so they bring up like 5x7 pictures, 8x10 pictures, framed with their own like light at the bottom shining because they're really excited about passing. So you guys come on in, and as you're coming in, kind of tell me what school you're from and where you're joining us from today, because I kind of want to hear and see. I see Casey Myers is watching with us today. Casey's one of our tutors, and so she's coming on to watch us today. But y'all tell me where you're from, so I kind of have an idea. And today, I'm going to be walking around a lot because I can't stay awake. I'm chugging coffee today. I don't know if any of y'all are feeling the same way, but I'm on struggle bus number 92 today, trying to stay awake because we've been teaching a lot. So you'll see me chugging coffee throughout the day today. Last week we did a free seminar for you guys. It is available on our Facebook page, and we will be downloading it to YouTube this week. We did it on just kind of talking about test taking strategies and the different ways that you can approach test taking, and just some big testing hints. So if you haven't checked that out, that is still available on our Facebook page if you click on videos, and you can watch the whole video as we talk about all kinds of things to help you get amazing on your tests, which you will. Today, because we had so many students say that they really want to talk about select all that apply, that's what we're hitting on today, the dreaded select all that apply. And the NCLEX has just recently changed this so that now you can only have just one answer on select all that apply. So we ask, why then does it say select all that apply if just one applies? We have so many questions, we may not get the answers. But today, we're going to be talking to you about how to master the select all that apply questions, give you some really good test taking hints, and help you to master these kind of things, because the select all that apply are hard in nursing school. They ask you what's the most orange, and things like that, and it's hard. And so we're here to help you to navigate that a little bit. So one of the first things I want to tell you guys above all today, and when we talk about test taking strategies, is that content is going to be king. So if you can use content to get you through any test taking anything, content is always going to be better. If you know the information, that's better than having to use test taking. But there are sometimes, inevitably, where the teacher said, you don't have to know this on the exam, and then you open up and question 1 is like, but I did have to know this on the exam. Y'all feeling me? This happens to you? So if that happens and you're kind of stuck and you don't know the content, then we will teach you the test taking strategies that can kind of help you to increase your chances to get it right on the exam, even if you're not quite sure of the content, okay? So let this wall inspire you, and know that all of you will be here soon, that you will make it. And let me let you take you down here just so you can kind of take a look. It may be a little bumpy, but look at all these people. They're nurses all over the world. Some people are volunteers, some people are doing missionary work, some people are in the med centers doing amazing things. And look, they all did it, and you can do it too, okay? All right, so I see some Lone Star people coming in. We have some Lone Star and some Co-Stock. We see them, and Rachel's here joining us today because Rachel, she likes to come here, and we like to have her. So look at all these people. Y'all will make it onto the Wall of Fame, okay? So once you graduate and you have learned all the things with us, please send us your picture, and we'll put it up on the wall, and then we'll send you a picture of your picture up on the wall, okay? So I see Ashlyn's joining us. We know you from Blinn College. We got you, girl. All right, so people are joining us from kind of everywhere. So what I want to talk to you guys about first, we've had a lot of people calling and asking about different services we provide here. So let me run through that really quickly so that you know what you have at your disposal as you begin your semester. Some students have already been in here or been in school already for a couple of weeks. Some people are just about to start. So it always helps to know what your resources are before you get to the point where you really need resources and you're kind of stuck, okay? So just a quick intro, my name is Amber Brown and I own Ivy League Tutoring. I also tutor here, we do lives here. So you'll be seeing my face a lot. You'll be seeing me drink coffee a lot because I need it and I have 2 children and I'm tired most of the days, all right? So with that said, let's talk quickly about what we have for you guys for the semester. We've brought a lot of new things. So we listened to everything you said last semester and we brought some new services to you. So let me run down those really quickly so you know how you can learn all the things this semester, okay? So number 1, we have these Facebook Live sessions that are free. Take advantage of them. I'm gonna do them every single week for you, usually on Mondays. We'll pick a different topic that you guys give us. You tell me, hey, this is what we're struggling with, what most people are struggling with, we will do a free topic on. These videos will get downloaded onto our YouTube page. So if you have not subscribed to our YouTube channel, you need to do that. We have tons of just free stuff just sitting there for you to watch. DKA, Cushing's, Addison's, fluid and electrolytes, the things that you struggle with. We've got insulin and infection precautions and they're free. Did I say they're free? They're free. And you're students and you need free things sometimes because we all get tired of ramen noodles. Do you know what I'm saying? I got tired of making grilled cheese sandwiches with my iron. Okay, I get it. I've been a student and I've been there. So those are just free and sitting there for you. So join our YouTube channel. All right, so we have these free ones, right? Did I say they were free? Because they're free. And then you guys can just tell us what you want. So even in the comments today, or you can message us, or you can email us and say, hey, man, everybody's struggling with, you know, diabetes or with insulin or with stroke or whatever it is. I don't understand Glasgow Coma Scale. Y'all tell us and we build a curriculum based off of you and what you need to learn, all right? Secondly, we do individual sessions. So if you're the kind of person who just does not learn in a group dynamic, having 15 people in here, it's too much for you, or being in a group of people in your classroom or in your lectures and you're like, everybody's talking and people are chewing and it's annoying and everybody's getting up and coughing and blah. And that just bothers you and you learn better just having a one-on-one tutor. We do individual sessions. It's one-on-one. You can either come in here, which we're in Houston, or located south of Houston. We do Skype sessions all over the world. We have students everywhere. We have students from India. We have students from Canada. We have students from every state in the US. So it doesn't matter where you are, we reach you, okay? So we have tutors that are experts in their fields. We have an OB tutor, we have a critical care tutor, a PD tutor, a NICU tutor, like we have it all. So they are there to mentor you. You will send them your information that you have on your next exam, and they will create a curriculum for you, and they will create a tutoring session that works based off of how you learn. So if you're an auditory learner, y'all are gonna be chatting for those 2 hours. If you're a visual learner, they'll have a whiteboard and we'll be drawing pictures for you. So that's a good like one-on-one, you're getting like the best of the best nurses that are teaching you in order to help you master these grades on your exam. That's individual tutoring, number 1. 2, we have Facebook Live sessions that are paid that happen every single week and we post them, all right? So those are 2-hour sessions. You can join in with us on Facebook Live, all right? So once you purchase or register for that session on our booking system, we send you a link. You click on the link, it takes you to a Facebook page. When you get to that Facebook page, that's where we live stream. We also have our expert nurse tutors on there. You can ask any questions related to that content and they're there to answer your questions, all right? We post the video there. So if you can't join us at the live time, that's okay, because we've got schedules from all over the world to navigate, right? So that video gets downloaded onto the page. So for 14 days, you'll have access to that video and you can watch it as many times as you want to and ask any questions. We'll post mnemonics for you. We post practice questions. So it's a good way to synthesize the information. All right, so individual sessions, Facebook Live sessions. Third thing we have is we have pre-recorded videos. So if you're like, I don't have time to wait, today I want to learn about GI drugs, all right? You go to our booking system, you look up GI drugs, you can purchase that video immediately, you get a link, you live stream it, you have it for 14 days, watch it as many times as you want to, learn it immediately, all right? And it's me teaching all the videos. You're gonna be tired by the end of it because I talk like this the entire time. So we're going to be working, all right? So those pre-recorded videos are available for purchase anytime you want to get them, and you can just get exactly what you need. There's no monthly fee, no hidden costs, we don't steal your credit card, we don't need all that. We just help you get whatever the information is that you need immediately, and that's it. All right? So that's the third thing. So we have individual, we have Facebook Live, okay? We do group sessions in here too. So you'll see on some of the videos, there's nursing students from everywhere that come in here and that do the Facebook Lives with us if they're local and they can come here. So you'll see that too. So individual, we're gonna repeat in here. Facebook Live sessions, you get pre-recorded videos. And then the last thing we do, which is super cool, we just started this last semester. Facebook Live on-demand sessions. Okay, so if you thought you couldn't get exactly what you wanted enough, we created something a little more specific just to you. So if you have a couple of students in your class who are really struggling, you have an upcoming exam, maybe you had a couple of self-taught modules that were just not making sense, maybe you didn't get taught in the way that you completely understand, you can call our office and say, hey, we have 6 students from this class, we have an exam on Tuesday, it's on DKA, and we are lost as lost can be. We want to set up a 2-hour tutoring session with an expert med-surg nurse tutor, diabetes educator preferably, and we want to do it at this time. Are they available? And we will do either a Skype or a Facebook Live with just you and your group on exactly what you want us to cover. How cool is that? That's so neat. Okay. All right, so if y'all have questions on what we do, please let us know. Okay. Ashlyn said, I can't wait to get my full-size wall decal of me on the wall. Girl, I know. And then Rachel says she loves the Facebook Live stuff because it's busy and lazy. I know. I'm the one doing the work. You're the one that can just sit and hang out and learn all the things, which is so cool. All right, so I'm going to move us over a little bit because I want to sit down for a second because I'm lazy today. So here, we're going to take you around. Look at all these things we got today. All right. So a couple things I just kind of want to talk to you guys about before I head up to the board and we get real. Okay. Let's talk select all apply. Okay. So, hold on. All right, last week we talked about how to manage your test anxiety, okay? We talked about if you are struggling with anything like the depression and the anxiety and things like that, ADHD, those are things you have to get taken care of like yesterday, all right? So if y'all haven't seen that video, please make sure you go and watch that, okay? So watch that one first as kind of a precursor. You can still watch this one and we'll pop in, but I'm gonna be talking about a lot of the concepts that I already talked about last week. When you're doing select all that apply, these just kill me and they kill students because you're like, what exactly are you talking about in this select all that apply and why do we have these? Okay, the select all that apply seem like they're super tricky, but I'm going to teach you some tricks today to where you're like, that wasn't quite so tricky, okay? There are some key words in some of the questions that are going to really clue you into exactly what they're looking for. So number one thing you're going to do when you're doing select all that apply, and I cannot tell you this enough, and I talked about this last week, you have to understand what the question's asking you. If you do not understand what the question's asking you, you will get it wrong, no matter how many test-taking skills I give you today, because you're answering something that they're not asking. So please, I'm going to be very clear. Do not look at the answers when you're doing select all that apply. You read the question and you stop at the question. You do not look at the answers. As soon as you look at the answers, your brain is going to try to trick you. It's going to try to find something that's familiar, okay? Remember, when our brains are uncomfortable with something, we do whatever we can to make our brains feel comfortable. That's just a survival mechanism that happens, okay? So I talked last week, it was kind of funny, I talked last week about if you like walk into a crowded room of people, okay, or maybe I did, maybe this is another session. Anyway, tell me if you've done this before, okay? You walk into a room of people, and let's say you're going to like some kind of party that you didn't really want to go to, maybe it's a work party or something, and you don't really know anybody, you kind of didn't want to go, you sort of just wanted to sit at home and pet your cat and sit in your Snuggie and like binge watch Netflix, okay? I get it, all right? But you have to go to this party, for whatever reason, it's like you gotta go and make an appearance. So you walk into the party, and all of a sudden you're like, I don't really know any of these people, and I don't want them to think I'm weird, so all of a sudden you get this like, oh, my phone is ringing, and it's not though, and you like pick it up and you're like texting, like somebody's texting you, but they aren't. Like you're just doing that because you're like, if people think I'm like busy on my phone, I'm like involved, they won't talk to me, right? Everybody does this because it's your way to feel good again, because your brain's uncomfortable. It's in a spot where it doesn't really like to be, and you're like, oh, there's people and everyone's weird and I don't want to be talked to or touched or looked at. And so your brain tries to do something immediately to make you comfortable. That's what happens in select all that apply questions or in any nursing school questions. If you see something in the question and you're not familiar with it, your brain starts panicking. You read it and you're like, I didn't study this, and she told us this wasn't on the exam, and it wasn't on the book, and you start freaking out. And so your brain knows, I'm not feeling good right now. So your brain says, I need to feel good like really quickly. So it goes right to the answers and it just tries to scan for something that looks familiar. Ah, Lasix, I know that drug, I'm gonna pick it. Okay, that's how this works. And you think it doesn't happen, but it does. That is exactly how our brains work because it is constantly trying to be in homeostasis and it doesn't want to feel uncomfortable. So here's the problem that happens is you're just looking for something familiar. You're not having any clue what the question is asking you. The first thing you should do with Select All That Apply is to read the question. Reword it in your own words to understand what the question is asking. The third thing I will say that will make a huge difference is to take responsibility for your patient. That sounds weird. But instead of saying, a nurse is taking care of a 72-year-old client, blah, blah, blah. Well, it's really easy for us to look on that question, and it's easy for us to make judgments based on what this nurse is supposed to be doing for her patient. Let me give you an example. Okay, if any of you have children, before I had kids, and I weighed like 1 pound, and I walked into the grocery store, I'd already done my hair and stuff, and my makeup was done, and I was buying my organic chicken breast. And I see these moms in there with these kids that are still in their pajamas and they have crusty stuff all over their face. And the mom looks a disaster and she had no makeup on and she looks flustered and the kids are screaming because they want a lollipop, right? And I look at her and I'm like, yeah, I'm never going to look like that when I go out somewhere. I'm always going to have my makeup done. I'm always going to have my hair done. And my kids will never behave like that at the grocery store. Newsflash, fast forward 10 years, and there I was in the grocery store, 2 kids, looking a mess, looking a fright, me looking a mess and looking a fright, screaming children, I want a lollipop, okay? So it does happen. But what can happen is if we're looking from afar and looking in, then it's very easy to make those judgments. If you flip it and you take responsibility, so instead of reading, a nurse is taking care of a 72-year-old patient, no, I'm taking care of a 72-year-old patient. And who am I in this situation? So you have to look in the question and see, who are you? Why does that make a difference? Y'all tell me, why does it matter who you are in the question or what kind of nurse you are? Why would that matter as far as answering the question correctly? You guys tell me while I'm moving the camera, okay? All right, I'm going to move this to the board, but if y'all look at the answers, I'm going to be severely upset because you're not supposed to, okay? All right. Does anybody know why you would say who you are in the question? Why is that important? Okay, well, let's talk about it. Let's say that I am a triage nurse, all right? So we know that a triage nurse is going to be at the front of the ER, right? Their job is to field these different clients that come in and decide who's got chest pain and is having a heart attack and needs to come back immediately, who stubbed their pinky toe 4 weeks ago and it still hurts when they bend it, okay? That's what we have to field out. Well, if I'm a triage nurse, okay, at a hospital, and I have 4 clients that come in at one time, and one of them is wheeled in and has a knife sticking out of his head, that's bad for him. The chances of him making it, not good. But I'm going to take that client back first as a triage nurse in the ER. Why? Because I have neurosurgery at my disposal. I have a CT scan. I have a surgical suite ready. I have an emergency response team. I have a code team. I have everything that I need to give this man the best chance of surviving. Will he make it? Probably not. Does he have a chance? Yes. So as an ER triage nurse, I'm going to take him back first. Now let's keep the same situation. You have 4 people that need help, but I'm not an ER triage nurse. I am a nurse that went out to a disaster, right? There was a stabbing, something happened at a school, all right? So I go out there, and I'm the one that's out there having to take care of these patients. Will I take care of the man with the knife in his skull first? No, I won't. He's not my priority because I'm not a neurosurgeon. I don't have a full code team at my disposal. I don't have a CT. I don't have surgery. I can't do any of that. So he would be somebody that we would have to not see first, which is unfortunate for him, and that's horrible. But in a disaster setting, as a disaster nurse, if I'm coming out there, that's not the patient I can see first because I can't save him. I'm going to see a patient that's in the middle, a patient that's not just having an anxiety attack because that was a horrible thing that they saw. I'm going to see the patient that got sliced through the femoral artery because I can put immediate pressure on that artery and give that patient a chance to live, and they probably will make it if I can keep enough pressure for long enough. Okay, so do you see the difference? It matters who you are in the question.
So the question is where you should be spending the majority of your time, not the answers. People usually do it the opposite way, and that's when you start to get wrong answers, okay? So number one thing, read the question. Understand what the question's asking you. Is it saying, what would you do first? That's a priority question. That means I need to do this thing to save my patient's life. Not because it's the easiest, not because I can do it the fastest, because my patient will die if I don't do this. And that's where you put up the priority charts like we learned last week. So if you didn't see that, we did priority questions last week. Go and take a look at that video, okay? Next thing you need to do, take control of the situation. There is not a nurse caring for a client. I'm the nurse taking care of the client, and I'm a trauma nurse, okay? Or I'm the nurse taking care of the client, and I'm a telemetry nurse, all right? That's going to decide what your priorities are and kind of how you can mold your care. Just doing those three things will increase your test grades dramatically because you're actually answering what the question's asking. You're understanding who you are. You're taking control of the question instead of letting the question control you. And you're not reading the answers and letting it make your brain feel familiar and comfortable. You're challenging your brain. All right? One other thing I want to reiterate from last week before we move on. I told you guys last week, if you see something that's unfamiliar in the question, your brain will immediately panic. As soon as it sees something it doesn't know, it panics. That's just what happens. You have to stop yourself right there, okay? And say, okay, I don't know this, but I can probably get some of this from context clues. If you can stop yourself, ground yourself, and say, I don't know, but I'm going to figure it out, and push through that question, that makes a huge difference. Now you have taken control over the question instead of letting the anxiety take control over you. Do we understand? Okay. The other thing I said this morning that's really important before we go up to this question, because I want to practice some things with Select All Apply and show you how easy it can be. Okay. Well, first I want to tell you, most test bank or most study kind of companies will tell you, take each individual row or each individual answer option as its own individual thing. And most of the time you do, okay? So if you know the content, that is true. Take it for face value and exactly what it is. A, is this true or false? It's true, I'm gonna pick it. B, is this true or false? True, I'm gonna pick it. There comes a problem with that when you don't know if it's true or false, right? What if you get to the content and you're like, I don't know if this is true or false, so how would I know if I can pick it? Okay? So if you know the content, go through each one and say, is this true or false? Pick it if it's true, leave it out if it's false. If you don't know the content, or if you're not sure about a couple of them, I'm going to give you some test taking hints to do that. Okay? Does anybody have any questions up until this point?
Oh, okay. Victoria asked a question. It's not silly. It's actually kind of funny that you asked that because it does seem sort of silly. Okay. So, Victoria asked a question where if it's computerized testing, how do you not look at the answers? Like, because you can't be the weird girl that's like covering them up, right? You're going to have to train yourself to read the question and then just turn. Like, even if it's just a little turn or you look down or you find a focus spot. Because I'm telling you, as soon as you read those answers, that's it for you. Your brain has already picked something, and it's very hard to talk it out of what you pick, okay? So you have to do a whole bunch of questions on the computer and just train yourself to read the question and stop. And then you start walking through, okay, who am I in this situation? And you may have to read the question 3-4 times. You know, I've had test questions where I've read it 3 or 4 times, and I'm still like, what are you saying, right? Like, I don't understand what you're saying. Don't move forward to the answers because you're frustrated. Stop at the question again and say, okay, I can't proceed until I understand what they're asking me. Does that make sense? And that's a really good question. It wasn't silly at all. Okay. All right. Anybody else have any questions before we move on? And I'm going to show you what to do when you have a list of symptoms or a list of things and you're like, I don't know what y'all talking about. Okay. All right. So let me show you this. All right. So let's say I'm not looking at the answers, right? Let's start with the question and kind of practice what we've talked about so far. Which of the following signs and symptoms would you expect to see if your patient has a blood sugar of 48? So what I would do if I was on the exam is I would stop there. All right, which of the following signs and symptoms? This is really important, okay? Signs and symptoms. Okay, because here's what nursing instructors will do, or here's what the NCLEX will do. In your Select All That Apply,
you will find in there like recheck blood sugar in 15 minutes or give a simple sugar, give 15 grams of simple sugar and follow up the complex carb. Is that true? Yeah. If my patient's blood sugar is 48, which is obviously not normal, it's very low, right? So if I know that they're hypoglycemic, do I want to give a simple sugar? Yes. Do I want to check their blood sugar? Yes. So those are things that I would want to do, but those are nursing interventions. They're not signs and symptoms. So I'm not answering what the question is asking. So those may be mixed in here. Check for tachycardia, check for tachypnea, do another blood sugar in 15 minutes. All true things, okay? But you have to look and see what are they asking me for, signs and symptoms, okay? There's another word up here that is superbly important, okay? It's this one. If you ever see this word in your nursing exams or on the NCLEX, that is a red flag, red letter word right there. It is expect. What would you expect to see? So it's not saying what are the following signs and symptoms could happen with your patient, okay? Which of the following signs and symptoms may you see? It's not saying that. It's saying which of the following signs and symptoms would you expect? What does it mean to expect? That means that every single time I know that this is going to happen. So if you see what would you expect to see, that means that every patient across the board. If you came up to me and said, patient's blood sugar is 48, they're shaky already. I'm already going to know that. That's what I would expect to see at a blood sugar of 48. Okay? So that expect word means a lot. You have to be careful with that, especially on select all that apply. Because you may see signs and symptoms on there that you may see in a client that has that condition. But it doesn't mean that across the board, pretty much every client is going to have this sign or symptom. So expect means these are like the tried and true cardinal symptoms, may see or possibly see. Those could be the extraneous variables that you may see. Let me give you an example. Let's say the patient has appendicitis, all right? Inflammation of the appendix. If a patient has appendicitis, I would expect to see severe pain, right? I would expect to see guarding and some tenderness, right? I would expect to see some rebound tenderness. I may see nausea, vomiting. I may see an elevated white count, but it doesn't mean that every client in the history of ever that has had an appendicitis had an elevated white count. They don't. Some patients come in with a completely normal count and they're having a full-on out appendicitis. So I wouldn't expect to see that in every client. Do you see the difference? So keep that in mind when they're asking you that, especially on a select all that apply. Because what they'll do is you'll look at it, and if you guys have ever done this on select all that apply, you go through every single one and you're like, yeah, it does. I picked them all. There's no way. Okay, now I have to unpick 2 of them. So which 2 am I going to unpick? And then you have to go through and make these like do or die Russian roulette kind of things, okay? And then you're trying to talk yourself into all different kinds of things. By the end of it, you're just like, I hate everything. And then you just like let fate pick it, okay? You don't have to do that. Watch for these kind of clue words and you'll know what to look for. So here's what I would do if I was on this exam. All right, I would go up here and say, which of the following signs and symptoms would you expect to see if your patient has a blood sugar of 48? Okay, blood sugar of 48. I would stop myself there and I would say, okay, what do I know about a blood sugar of 48? What's a normal blood sugar? Okay, normal blood sugar should be somewhere around 60 to 100. So I know that this is low, so this patient has hypoglycemia. So what is this question asking me? Well, they're really asking me, which of the following signs and symptoms would I expect to see in a hypoglycemic patient? So without even looking at the answers, I'm going to come over here and write on my whiteboard, or I write on my paper, whatever it is they let you write on. What do I know are the signs and symptoms of hypoglycemia? Well, if you guys have ever seen Still Magnolias, you should know exactly what hypoglycemia looks like, because Julia Roberts has this beautiful hypoglycemic episode in the salon with Sally Field and Dolly Parton. And if y'all have not seen that movie, I cannot tell you how much you need to go see it. And don't say you don't have time because you're in nursing school, because I know 98% of you binge on Netflix shows, so you have the time. It's one of the best movies of all time. And there's a lot of different things you can look in there and find out about diabetic care. So it's actually, you're learning at the same time. So like put down Grey's Anatomy for like 1 second and like pick this one up. It's a good one. Okay. So in my mind, I would be either in my mind or on the piece of paper, on the whiteboard, whatever they give you at your class. You're going to be writing out all the signs and symptoms that you know of hypoglycemia before you look at the answers. Because as soon as you look at the answers, your brain's going to be like, oh yeah, it's totally that. And then you start writing it down, not even thinking that wasn't one. I just saw it and it looked familiar and I picked it. okay? So I would write out everything I know. So you guys tell me, what are the different signs and symptoms of hypoglycemia, and kind of walk me through what those look like. Now, his blood sugar is not 12, so please keep that in mind. His blood sugar is also not normal. So you have to take it into context. What would I see with a mildly low blood sugar? So you guys tell me. I'm going to give y'all a minute. Y'all tell me what are signs and symptoms of hypoglycemia. And y'all that have answers, we have not gotten there yet. Okay. Rachel, you said that's your favorite movie? Girl, I knew we were meant to be. I knew it. I knew it. Victoria's seen it too. She gets it. You know what I'm talking about. All right, so Rachel says cold and clammy skin, diaphoresis, tachycardia. When you guys give me these signs and symptoms, provide me with the rationale of why they have them. In nursing school, if you memorize signs and symptoms, I promise you they will leave you, okay? Especially when you go into the NCLEX and like you're just trying hard to not like poop yourself in there or to vomit. It's going to be really important that you're able to give yourself rationales for why these things happen, okay? So when you're giving me signs and symptoms, I need a rationale, okay? Let's do it. Oh, Claudia says she saw it and she cries every time. See, we know. Okay. All right. What do we got? We got cool and clammy skin, shaky, tachycardic, anxiety. Okay. So I would walk through in my mind, what happens when a patient goes hypoglycemic? Well, they don't have any sugar. So where do all my signs and symptoms come from? When your body is deprived of sugar, that tells my brain, or my brain doesn't have enough sugar to survive, so it starts to do weird things. So the very first sign and symptom of hypoglycemia is what? And I'm going to give you a little Pearl fun fact for test taking while we're here. Anytime the NCLEX or your nursing instructors ask you what is the first sign and symptom of this, whatever this is, it very rarely has anything to do with actually this, okay? First signs and symptoms are usually very generic. They're usually not exactly in the same body system. All right, let me give you for instance. First sign and symptom of hypoxia. You would think like shortness of breath, blah, blah, cyanosis. No, it's restlessness and anxiety, okay? First sign and symptom of digoxin toxicity. Digoxin's a heart drug. So what do we see first? Nausea, vomiting, anorexia. That's a GI system, right? Let's see, first signs and symptoms of lithium toxicity. Nausea, vomiting, diarrhea. Lithium is a psych drug, that's a brain drug, and these are GI symptoms, so you see, when they ask you first signs and symptoms, it very rarely is in that body system. What is a first sign and symptom of tuberculosis? What will people pick? They'll pick bloody sputum. Y'all, these people do not just wake up one day with tuberculosis like, and then like cough up blood. It does not work that way. They start to feel super crappy first, right? So they get these very vague constitutional symptoms, weight loss, fever, fatigue, night sweats. Those happen first, and then they start to have other signs and symptoms. When you think about it, if you say first signs and symptoms, nobody ever just like wakes up with weird stuff happening. That just doesn't happen. Like if you're like, what's the first sign and symptom of MS? Multiple sclerosis, and they're like ataxia. I'm like, really, all these people are just walking and all of a sudden they're just like this? That doesn't happen. First sign and symptom of multiple sclerosis is muscle weakness or fatigue, okay? So we don't, just remember that for test taking purposes. If they ask you first signs and symptoms, rarely is it ever in the same body system. So stop trying to match the neuro disease with the neuro signs and symptoms. They don't match, okay? All right, so let's go back. Okay. So now we see the signs and symptoms of hypoglycemia. So you guys have listed some for me. Now you have some content. So remember, content is going to come first. So if you know for sure that tachycardia happens with hypoglycemia and you would expect to see that with a blood sugar of 48, I would pick it, okay? If I am for sure that this patient gets cold and clammy skin, cold and clammy, need some candy, and you know for sure, then you pick it. All right, if you're 100% sure, maybe not 100, maybe like 95, you're like, yeah, I got this, okay. If you're not sure, or you're kind of stuck in this middle ground, you're like, I'm really not, I just don't know. I know these for sure. I'm not sure about the other ones. All right. A lot of select all but apply questions, when they have all of these out like this, and they just have signs and symptoms, you can almost always divide them into two categories. Watch this. All right, we're gonna group like ones together. Tachycardia and tachypnea. My heart's going crazy. Chances are tachypnea is gonna come along with it. These are things that are increasing, increasing. Well, this is bradycardia. This is decreasing, right? So this would go on the other side. So these are things that increase and these are things that decrease. Hot flush skin, that's something that would happen, but look, you have to be careful with this because we had cold and clammy skin, right? You would think that this would be with something that was increased, but you were absolutely sure that the client had cold, clammy skin. Can they have hot flush skin at the same time they have cold, clammy skin? No, they cannot. So if these are two different skin assessments and they're opposite each other, remember last week we talked about opposites. If you have two that are opposite each other, it's only going to be one. You pick one of those. It's got to be one of those. These two are opposite. You told me for sure it was cold and clammy skin, so I would just rule that one out as even an object, right? Something that I would even see. Now seizures, where does that come into play? Do you know anything about seizures and hypoglycemia? Do they get that? Y'all know? If you've seen Still Magnolias, you'll see they can have seizure activity. Because what we said was hypoglycemia is your brain is starving. Your brain doesn't have the sugar that it needs to have energy. So you do start seizing. Now hold that thought, okay? I would think that seizures would be like on the upside, right? Okay. I would also think hot flush skin would be on the upside, all right? So I have divided these out into two. But I already said hot flush skin was opposite cold clammy. I know for sure it's cold clammy, so it can't be my hot flush skin. Did I put D? Oh, put D. Yeah. Okay. So I know it can't be that. But these are two categories I can see. These are things that increase. These are things that decrease. Well, this one's the only one over here. And I knew for sure they had tachycardia. I have two opposites here. Tachy, Brady. If I knew for sure it was tachy, can't be Brady, can it? So if I have nothing left on this side, it has to be the ones from this side, right? So I'm going to go back and see, not only these are signs and symptoms of hypoglycemia, would I, here's my last portion to it, expect to see these? Would I expect to see tachycardia? Yeah, that's the first sign and symptom of decreased blood sugar, of hypoglycemia. So yeah, I would. Would I expect to see tachypnea? These kind of go together. So if I'm going to pick one, remember last week we said, if they're too like each other and they're too close, we either have to pick them both if they're a select all that apply or pick neither. I know I'm picking one, so I got to pick the other one. We said this one's wrong, this one's wrong. Is every single client that has a blood sugar of 48, would I expect to walk in and they're seizing? No. Is it a possibility? Yes. But would I expect it? No. So what am I left with here? We had F that we already chose, right? We chose A and B because they were the most alike. So if I'm going to choose this side, I'm going to choose A, B, and F. Does that make sense? What y'all think? Julia Roberts had one. Claudia, you are right, okay? And Lori said if the blood sugar were lower. If I change this, and I set a blood sugar of 20, would I expect to see that? Yeah. This patient is most likely seizing. Okay? Does this make sense? I'm going to take advantage of this, figure out who am I. I'm obviously a med-surg nurse. I'm looking, I know this patient has a blood sugar of 48. That probably means the tech came and he did the blood sugar and then they ran over to me like, hey, Amber, your patient's blood sugar in room 212 is 48. I'm already going to know going in there what I'm going to expect to see. He's going to be shaky. He's going to be tachycardic. He's going to be kind of breathing weird. He's probably going to be sweating a little bit, going to be cold and clammy. I already know what to expect when I walk in there. There's no surprises for me. Boom, I'm a good nurse. Boom, okay? What would you expect to see? All right? So then after you put yourself as a nurse, figure out who you are in the situation, talk about everything you know about whatever the condition is that's in the question. Walk myself through it. That way I'm picking the answers instead of letting the answers pick me. Then I'm going to go through, and if I know content, content is king. So always go with content first. Test taking will come second. If it's a list of signs and symptoms like this, divide it out into two, put them on either side, pick a side, boom, there we go. Easy enough? You ready to do this? You have any questions before I erase this and move forward? We got it. Everybody says happiness. Yeah, we good. All right. You're going to get one to do all on your own. So nobody write the answers yet. Okay, I'm going to give you guys a few minutes to go through this whole process. Okay. Let me think what I can be mean with. Okay. Okay. You know what? I'm not even going to give you the answers yet. I'm going to start out with the question, let you guys work through that part, and then I'll write the answers until you've trained your brain not to look at them. Okay, here we go. So you guys start working on this. A nurse, you, is taking care of a 48-year-old client with a history of traumatic brain injury who has been diagnosed with diabetes insipidus. What labs would you expect to see? So I want you guys to look first. I want you to take responsibility, understand what the question is asking you. Look for your big code words here. Start working through the question. I'm going to give you a few minutes to do that. Once you've done that, I'm going to write the answers, and then I'm going to give you guys a chance to do this all on your own. All right, how we doing? You guys ready for the answers? So what you should have done, taken responsibility. I am a nurse taking care of a 48-year-old client with a history of traumatic brain injury who has been diagnosed with diabetes insipidus. All right, so what do I know about this? Okay, chances are I am probably an ICU nurse. Why do I think that? The patient's had a traumatic brain injury. He's got DI. DI, you have to do tons of titrating and measuring and doing all these different things, right? And so if I'm having to do that constantly, chances are this is an ICU environment, right? This is an unstable patient. Patients I know, patients with a traumatic brain injury can often go from DI to SIADH to DI to SIADH, and that requires frequent monitoring. So chances are I'm a critical care nurse. I'm taking care of this guy with a traumatic brain injury. How did he get DI? And I'm not going to tell you, but that's something I would ask myself. How did he get DI, and what is DI? What would I expect to see in DI? So the next thing that I would do, and I'm not giving you all any answers because I want you to do this on your own, but I'm walking you through the steps so you can make sure you've done it all. The next thing I would do is say, okay, what labs would I expect to see? What do I know across the board every patient with DI is going to look like? So over here, I would write, or you can think in your mind, or you can write on a piece of paper, what do I know the signs and symptoms of DI are? Okay, this, this, this. And every time you give yourself a sign and symptom, you have to give yourself a rationale so that you can walk through it. Because once I give you the answers, you're going to require a rationale. That is one of the biggest things I can tell you with test taking, select all and apply, any test taking at all. You have to provide yourself with a rationale why you're taking an answer out as an option or why you are choosing it. Because what will happen is I'll have clients that come in or students that come in and they're doing test taking and I'm like, well, why did you pick that? Well, it sounded right. No, you have to give a rationale. I would say, well, I chose a low sodium level because this patient has overhydrated with water. The water is going to dilute the sodium, so it's going to give them hyponatremia. That forces yourself to look at it and say, I know why I'm choosing what I'm choosing. And then if you're taking something out, provide yourself with a rationale why you're doing that. Most students will cross something out and just say, well, that doesn't really sound right. Or, I don't remember learning that. Newsflash, I don't remember learning half of the stuff they test us on, right? But I'm still required to know it. So just because you've never heard of it, or she didn't say that in class, that's not a rationale. A rationale is saying, okay, what do I know? I know patients that have tumor lysis syndrome get high potassium because the cells burst and the potassium gets released. So I know they have high potassium. I know potassium and sodium typically go on a seesaw. So if their potassium's low, their sodium, or potassium's high, their sodium is probably low. So I would expect hyperkalemia and hyponatremia. That's a rationale, okay? And that's how you do test taking. Okay, so after I write out everything I know about DI, right? Then I'm gonna go on to my answers and try to see if I have picked my answers. Are you guys ready? This one's hard. I made it hard for a reason, and I'm going to give you about 72 answer options. Are you ready? All right, and I'm only going to give you 2 minutes to do this, okay? All right, because I'm going like way over time because I'm excited. Okay. Okay. All right, so here's what I wrote. You guys get to going. So remember, content is king. You'll always go with content first and what you know. So if you've selected them over here and you're 95% or more sure that they are signs and symptoms of DI, go ahead and pick it. The ones that you're not sure, you go ahead and create your chart, okay? And there usually is 2. In this one, there's actually 3. Okay? And you just pick one of the 3 because I gave so many options, all right? So start going through each of these. And what I like to do when they give me labs, I like to put on the side if they're high or low. So that way I'm like, okay, I don't forget it. So the first thing I would do here is say specific gravity 1.005. Is that high or low? All right, what's a normal specific gravity? 1.010 to 1.035. I know that this is low. Sodium, 153. What do I know? Normal sodium is 135 to 145. This is high. That way you can kind of watch and look and see what you're doing and you don't get mixed up. Okay? All right, so you guys have a few minutes to get on it. All right, so here we go. All right, so the next thing I would do, blood sugar 248, obviously that's high. Specific gravity 1.040, well I said earlier specific gravity is 1.010 to 1.035, so that is high. Hemoglobin A1C 8.4, yowzas, that's high. Sodium 131, since normal is 135 to 145, that is low. Okay, so just looking at my test taking across the board, I already know that I have a high and a low specific gravity, so it has to be one of those. I already see that I have a high and a low sodium, so it's got to be one of those and one of them's wrong. What do I know about DI? What is diabetes insipidus? Even though it says diabetes, does it have anything to do with blood sugar? No. But even if we didn't know, all right, I would put my hemoglobin A1C over here, right? So let me just put the number. If it has to do with blood sugar, which 2 of them do, we have C and we have E. Okay? Those 2 have to do with blood sugar. All right? The things, all right, so if I know that my specific gravity is low, The specific gravity, that's really close to water. So that means I'm peeing out copious amounts of water. So if I'm losing water, that would make sense that my sodium level would be high because I peed out all the water that just left me with salt, right? So A and B would actually go together, right? Okay, A and B would go together. Then we have where I'm not peeing out very much at all, right? What's the specific gravity of 1.040? All right, Mariah says, C and E are supposed to trick you. It has nothing to do with sugar. You're right. And this is one of those where they're expecting you to see diabetes, blood sugar, and pick it. So if we know for sure it has nothing to do with that, we could already rule out this side. This is just a wrong side, right? Okay, so that leaves us with what? If we knew, all right, I know diabetes insipidus. The only reason really why they call it diabetes is because you're peeing out a ton of really dilute urine, which would make my specific gravity really low, right? So you're going to look for your opposites. This was opposite, so D would go here, right? And what was my opposite? F would go here, okay? So if I know it has nothing to do with blood sugar, I can rule out these. So C, E, gone, okay? Then it either is A and B or D and F. Well, let's go back and look. If I know that I have a brain injury, what do you guys think? We know that it's diabetes insipidus, which means I'm peeing out copious amounts of urine. If I'm peeing out copious amounts of dilute urine, it's got to be this one. And all I have to know is the very basics. Now, would I expect to see a lot of, or specific gravity that's low? Yes. Would I expect to see a high sodium? Yes. So the answer is going to be, select all to apply, E and A. And you're done. Does this make sense? Easy enough? Dum, da, da, da. Do we have questions on this? Does it make sense? Is it easier? What do we got? Questions, comments? We could practice this all day, okay? So it's something you're going to have to do some practice with, all right? Practice it over and over again until you're comfortable with it and you understand how to do the test taking. Make sure you watch the video from last week, okay? If you guys have any questions, you can post it on this feed. If you have anything that you want to see, because I haven't set next week's free one yet. So if there's something you guys are just burning up about and a bunch of you want me to do it, then we'll set the topic for next week because I'm undecided, okay? But just so you know, this video will be downloaded onto our site. We're going to download it onto Facebook, so make sure, download it onto YouTube. So make sure you go to our YouTube channel and you subscribe to our YouTube channel, all right? And then we will see you guys back next week, but you have to let us know what you want to see, so let me know. I hope this was super helpful. We'll be doing some more test taking, I'm sure, in the future to get you guys ready for the semester, okay? So it was fun working with y'all today. You did awesome. You're smart. You learned all the things. We will see you again next week, okay?